librarians and information specialists present, but I also know that these sessions do appeal to some general researchers working in the kind of areas that systematic reviews relate to. So you will forgive me, I hope, for just spending a little bit of time explaining some basic searching stuff that everybody needs to know, because it's hard without knowing that foundation level information about searching to then move on to some of the other things I want to say, which may be about when we bend the rules when searching for the purposes of a qualitative systematic review. Or, as you'll hear me saying a lot, a qualitative evidence synthesis, which is Cochrane's preferred term, and my colleague Andrew Booth's preferred term. That's the question people always ask me when I meet them at conferences. Do you work with Andrew Booth? Yes, I do, quite a lot. And most of the best ideas and best content in this presentation is borrowed from Andrew in some way, from experience working with him or from his brilliant Esquire course, on which I also teach. So you're just getting the searching focus of that today. I hope that whatever level you're at, I hope you'll get something out of it. And if some of you are actually at a much more advanced level in terms of your knowledge of qualitative research than I am, please do chip in at the end, because it is a conversation. And while it's difficult for one person to have a conversation with a couple of hundred at the same time, there is going to be time for questions. So maybe I can learn something from you as well. So I wanted to start off by asking what systematic searching means to you. This is kind of a rhetorical question, because I think there are so many that it'll take quite a while to source all your replies. But I just want you to ponder that, because you might have certain preconceptions about systematic searching. I know that I did when I arrived at SHA, because having been a subject librarian for a number of years working in health, I'd supported many people doing systematic reviews. And I had this idea in my head that it was all about being comprehensive and reproducible and transparent. And I still believe in those things, but I also believe that there are circumstances in evidence synthesis when we might just alter those parameters slightly. Our sense of what it means to be comprehensive might change, depending on whether we're talking about the traditional systematic review of effectiveness, where you're dealing with trial evidence and you need every single trial just to make sure that you're not distorting what the evidence says, versus a qualitative type of review, where perhaps what you're really interested in is making sure that all the relevant voices are heard and all the relevant perspectives are considered. So it's a slightly different sense of what it means to be comprehensive. It's every single viewpoint, perhaps, rather than every single study. I like to start off with many of my presentations with this diagram. Apologies, the reference isn't on this slide, but it is on the next one. It's from Gusenbauer and Hadaway, what every researcher needs to know about searching, because I think it usefully distinguishes between the different types of searching, the different modes which you'll need to employ. Everybody does more than one type of search. We're not systematic all the time. And you need to have your goals in mind. And this is something where I want to say later in this talk that in qualitative types of evidence synthesis, there may be different heuristics at play at different times in your review project. So the most basic kind of search is the lookup search. And this might be looking for a handful of articles that meet a very narrow set of criteria. It might be that you're looking up a specific fact, something you already know or half know and just want to check. It might be that you want to answer a very specific question, such as when was this treatment introduced? When was the reorganization of the NHS? Which particular one of those you might be talking about. It might be about verifying something that you've heard suggested elsewhere. Or refinding a paper that someone sent you but you didn't save in the right place and you need to just check up on. So that's a very kind of targeted search that we all do in our daily lives, and it's even got to the point now where we can tell our phones to do those kind of searches for us quite frequently. The next mode of searching might be a more exploratory search, as you do perhaps if you're scoping out a topic. Maybe you're developing a bid, some sort of research proposal or protocol, and you want to explore a topic to understand it. It might be that you start off that process quite vague on what the boundaries of your topic are, and maybe over a series of iterations, you become more confident in drawing a boundary around the topic. Sometimes it's actually what we call a negative search. So it's about deciding where there's going to be a gap in the knowledge that suits further exploration. And then Goosenbauer and Hadaway describe a systematic search as being one perhaps closer to my initial understanding of it, which is the idea of identifying all the records on a specific topic through a search that is unbiased, transparent, and reproducible. By finding every study, rather than being selective, you're helping to reduce the risk of bias. By making your methods transparent, you enable the person peer reviewing or reading your report later decide whether or not you've done a good job. And by being reproducible, you ensure that every step, every search you've run can be verified by anybody who's doubtful of the veracity of the approach that you've taken. And that gives your search a kind of credibility, which the more selective, exploratory kind of searches maybe lack. And there's been great emphasis on how to do that kind of systematic search. There are standards on how to report them. There's lots of guidance published about how to do it. And certainly if you're doing a Cochrane review or another type of review of effectiveness, that is the sort of procedure you're expected to follow. I think many of you will already know that kind of procedure. I will just briefly illustrate that shortly, just for anybody who is maybe less familiar with that. I know some people might have signed up for this wanting to learn about searching in general, whereas others might be specifically interested in searching for qualitative evidence. So I'm going to try and cover a little bit of both. In terms of deciding which search mode is going to be most appropriate for your review or evidence synthesis project, there are three questions which my colleague Anthea Sutton poses to you. Is your review intended to be aggregative or interpretive? So an aggregative review is counting the number of studies that say a particular thing, or counting the number of patients involved in those studies if they are clinical trials, for example. Or is it an interpretive type of review where you're going to deduce meaning from studies and do something more selective in terms of how you use the data? Is theory going to play an important part in your review? I've become interested recently in realist reviews, and I'm working on several of those, and that's very much a theory-based approach. You look at existing theories, you discuss with stakeholders which ones might be appropriate in the particular context in which you're interested, and then you look for empirical evidence to support or contradict those theories. Perhaps you're interested in something where there are differences in context, which would be important in understanding your results. So it might be that a particular intervention works in one setting, but not in another. It might be there are different subgroups, different target populations involved, or different geographical settings. And if you know that something has been tried across multiple settings, it's important to have that in mind so that you can look for evidence in all of those settings and contexts, as it might affect your ability to understand what it is you're searching for. I think if I had one word to describe what I mean by a systematic search, it's deliberate. It's being deliberate about the steps that you're taking and understanding their implications, thereby avoiding accidentally overlooking sections of the evidence base because you hadn't considered them, because you constructed your search in what seems to be a logical, convenient way for a particular database, but didn't have the big picture in mind. So a deliberate systematic search is one that is understanding the purpose that it's striving towards at every stage and conscious of any risks of potentially missing things that they might be taking as they go through that process. I should say that not all qualitative reviews or qualitative evidence syntheses are the same. So I've made some generalizations already that some of you who know about this stuff might already be feeling disgruntled about. I've been suggesting that qualitative reviews maybe don't need to be quite so comprehensive as quantitative reviews. Well, that depends what type of qualitative evidence synthesis you're undertaking. So some qualitative evidence syntheses are aggregative in the same way as a quantitative review. So a meta-aggregation would require you to find every single study because you do need to know about all that data. You're counting the number of times a particular finding is expressed. If, however, you're conducting a meta-ethnography, then a more configurative or interpretive type of synthesis is going to be applied. So therefore, it's more about finding different perspectives, different voices. And that means that you could potentially be more selective, or I prefer the term purposive or purposive, in your approach to searching. So you're making decisions about which places to search and how to search them, understanding that you're basically trying to make sure you've sampled all of the different perspectives and voices. And the same applies with contexts. There's a long list of qualitative evidence syntheses, and I won't be able to. I hope you don't ask me questions about which ones use which methods, because I may fail to answer them. But I do know an excellent source to go and look them up, which is the article by Sutton et al., on which I was also a co-author. There's a supplementary material section that goes with that article. You might know the article already. It's called Meeting the Review Family. The supplementary material for that article in Hilge features a table of many different types of review, and then advice on how to conduct a search for each of them. And there's a long list of qualitative evidence synthesis types in there, which Andrew's put together based on the best available guidance or best practice. So if in doubt for a particular review you're working on, check out that table. It's not in the main article. You have to go to the supplementary material. One thing that's changed in my understanding of searching when I moved to SHA from being a librarian, I've stopped thinking about myself as a search person. I still love searching. I still could talk about searching for hours, and I do. I run a course on searching where I get to nerd out with other people who are interested in all the different syntax and hacks that are available. But when I'm working at SHA, I'm always working in multidisciplinary teams with reviewers, with modelers, with statisticians, sometimes with clinicians as well. And these people aren't interested in my clever use of adjacency operators or truncation or whatever. They have particular needs in mind, particular information needs, and they're thinking further down the review process as to what the implications are of my search. So they want estimates from me in terms of the numbers I'm going to retrieve, because they're thinking about how difficult it's going to be for them to screen those and how long that's going to take. And I found it useful to try to look at the search from both perspectives, not just the uber thorough librarian trying to make sure they find every record, but also the reviewer later in that process, who's then got to deal with the process of study selection from within the results. I find if you think about those two things at the same time, it's quite helpful. Now, you may be in a different type of role where you are performing both of those functions. Lots of researchers do. And actually, I'm moving into a more hybrid role now where I am leading a couple of review projects at the moment. So it's not an unusual path to take. When it comes to deciding which studies you're going to include, of course, you'll have some eligibility criteria. But typically, particularly in the more interpretative review types, these may be less set in stone than they are for a traditional systematic review. And sometimes you'll have priorities that you want to address, and you'll pick the studies which best seem to meet those priorities. Often it's about finding an acceptable balance of these three R's: richness of data, relevance to your context, and rigor, as in the quality of the study. And I would also caution anybody here, particularly any students here, to not be looking to create a search strategy which delivers them a final list of studies. It's not like prompting ChatGPT to give you a quick answer to something and ta-da, there it is. There are your 6 studies that meet your criteria. It's about reducing the size of the literature to a manageable number of records that you can then go through manually and select the ones that are going to be suitable. What you consider manageable, of course, will vary. There'll be personal preference, and it may also depend on your topic, because some topics are very easy to screen. It's very easy to discard the irrelevant material. Others, it's a lot more complicated. You have to dig into the abstracts or maybe even into the full text before you can make a decision, and that's much more time consuming. Some of you will be thinking, but we have software that can do that for us. There is software available. I will allude to that later, but I would say that the software currently available is only as good at making decisions as you are, because generally it's learning from your decisions. So you still need to have clear focus about what it is you want so that the software can learn. Every search you do is going to be a trade-off between sensitivity and specificity. If you're not familiar with those terms, sensitivity is the ability of your search to find all the studies which are relevant. So all the all the studies that you wanted within a given set. It's about your chance to find as many of those as possible. And ideally, you're aiming for 90+% of the relevant material to be found with each search strategy. Bearing in mind there'll be others that are picked up through supplementary methods, things like reference lists, which I'll mention later on. The other priority that you balance off with sensitivity is specificity, which is the desire to eliminate noise or irrelevant material from your results. So you just want the stuff that is going to be relevant to you and not too much else. But it's unrealistic to expect a very high level of specificity. I think if you're getting 1 in 10 records that are relevant, you're doing very well. Typically, we score much lower than that. You might get 1 in 10 that are superficially relevant, but beyond that, you'll find that actually when you investigate them, they're not eligible for inclusion. And if you're interested in those scores and how they're calculated, there's a lot of literature about it. I'd particularly look at things like the number needed to read, the NNR, which is a measure Andrew devised to assess the effectiveness of various search approaches. Some people obsess over searching, like me, and try to spend a lot of time perfecting a search to minimize the screening burden, to make it very focused, avoid bringing back too much rubbish. But even so, there'll always be some irrelevant material in there. Other people are quite happy to cast their net wide and sift or screen very large numbers of records. Again, what's large is subjective. I'd say a typical review is probably a couple of thousand, maybe 3,000 or 4,000 at the most. But I have worked on ones with 20,000 reviews, 20,000 records retrieved, and the reviewers have had to deal with those. It's obviously taken a lot longer. And if you are dealing with a large search yield, it's important to make sure that you're consistent over time and that you don't experience mission creep as you're going through that selection process. Otherwise, you're in danger of compromising the objectivity of your review. The third option really is to favour a series of iterative searches over the period that you're working on a review. So instead of trying to get it all right first time, whether with a big yield or a small yield, it's honing the search over time and allowing the inclusion criteria to emerge as you explore the topic. Now, this can be very difficult to report in a way that is systematic. It can be very difficult to give the reader or peer reviewer confidence that you've done this in a rigorous way. But sometimes it is necessary for topics where concepts do emerge over time, and you just need to keep some kind of narrative in mind as you're going through the process, saving your search strategies at each stage, and also describing the thought processes that you went through in order to make those decisions. So it's making it clear that what you did was deliberate and conscious, and you realize that the potential limitations of that approach at each stage. Qualitative evidence synthesis is not easy, and nor is the searching. Okay, before I go into some qualitative search methods, just to make sure everybody's on the same page about what I would call classic systematic search methods. So if we were doing the review of the effectiveness of a particular treatment, we'd be using a question framework off the shelf. We've been conducting a scoping search to get a sense of how big the literature was, and writing a protocol or kind of recipe of how we were going to conduct the review, what the search was going to look like, which studies we were going to include and exclude. We'd devise a search strategy, including sources, search terms, and then we'd run that. The most common question framework that we use for that type of topic is PICO, which is population, intervention, comparison, and outcome. In fact, we don't always search for the comparison and outcome. It's often sufficient to search for population and intervention, and then apply a study type filter. So typically for that type of review, it would be something like randomized controlled trials. And in each case, we'd search for our concept, and then we'd search for a series of synonyms or related terms around that concept. We combine the synonyms with or, and then we combine the different concepts with and. So you've probably seen things like this many times before, but just in case you hadn't, that's what I'm talking about when I talk about a traditional big bang search. Let's put that into practice. Let's imagine you were working on a project or as often happens with me, you've been approached by a family member who wants your opinion about something that the doctor's told them to do. I'm not a doctor, I can't give medical advice, but anyone who works in this field will probably vouch for this idea of getting asked by people you know about whether they should agree to a particular treatment. Anyway, let's imagine they wanted to know about the usefulness of statins for lowering bad cholesterol in people with diabetes. So just did a very quick search for this. This is by no means a perfect search, but it's the kind of structure that you'd be using. So first of all, we search for our population, which is people with diabetes. There we've got the subject heading, diabetes mellitus. That's Medline's preferred term for diabetes. We've got a truncated version of diabetes or diabetic that we're searching for in titles and abstracts. We combine those together into one megaset at line 3. Then we look for statins, and again, we use the mesh term, which I'm not even going to try to pronounce that, a very long word for statins, and we've exploded that to include all the specific statins. And then I've got a line specifying just the general word that we all use for them, statin, or a couple of specific ones mentioned in titles and abstracts. Combine them with or, and then we put those two megasets together, so line 3 and line 6, with line 7, which is what we call a study filter. So this is an expert search strategy we take off the shelf, and that's designed to find randomized control trials within the topic that we've just searched for. So it looks at publication type, that's what the PT is, and it looks in free text, like titles and abstracts, for randomized or placebo. That comes from McMaster University, who make some very nice, concise search filters of this type. Other filters are available. I've just used that one because it fitted nicely on the page. So that's the structure of a classic search. Now, if I was actually going to be submitting that to NICE, I'd probably add some additional terms to that. I'm sure many of you can think of ways in which I could improve it, but I'm just giving you an idea of the structure. And the numbers that retrieved, a couple of thousand, that's not bad for Medline. Obviously, there'll be other databases involved as well. So maybe we'd be looking at 5,000 or 6,000 or something in total, depending on what the other databases had in them. Okay, so that was the PICO question framework. Now, there are many question frameworks out there. Andrew positively collects them, and here are some of the others he's found. I can't say I've ever seen Cocoa Pop out in the wild, but I still hope to. I do use Behemoth, if that's how you pronounce it, quite a lot when I'm looking for theories or frameworks, particularly when I'm working on realist reviews. Also, Chemo or CIMO, that one's useful for the same type of review. You may recognize others on there. I wanted to highlight a particular one that we use a great deal in qualitative evidence synthesis, which is SPICE. It's another one of Andrew's acronyms. So in this one, rather than PICO, we're looking for setting, perspective, slightly contrived, phenomenon of interest, and then a comparison and evaluation. And again, these elements, they're not compulsory, they're really prompts to make you think about the different facets that would need to be present in an article for you to want to retrieve it. It might not be that they all need to be identified through the search. Some of them might be identified at the screening stage. Some of them might not be relevant at all, but they do make you think about your topic in a way that I think is useful. So what is helpful about SPICE? Well, it recognizes the importance of context. And as I said earlier on, it might be that there are different contexts which you need to take into account and that you need to find evidence about all of them. Similarly, with perspective, it puts that front and center and makes you think about whose perspective are you looking at this question from. And if it's more than one type of stakeholder, then make sure that you capture them all. Comparison is optional. And rather than thinking of outcomes, because it's not always qualitative reviews are asking questions about outcomes, it's often about evaluations, about people's opinions, more complex exploratory topics, and evaluation just seems to lend itself a little bit better to that. Let's have a look at that in practice. So this is a SPICE analysis of a question related to remote maternity care. So I've based this loosely on what was actually a realist review that I worked on rather than a qualitative review, but I thought it was quite an interesting topic. So let's imagine we're interested in patients and healthcare professionals' perspectives on remote maternity care. We might say that the setting for that would be the UK, knowing that our own health service operates a little bit different to others. The perspectives at play here are those of pregnant women, midwives. I suppose potentially we could be interested in other health professionals like health visitors or GPs. Might also look at the perspective of fathers as well as mothers, if deemed relevant. The phenomenon of interest here is the main thing, and the thing that's going to narrow it down greatly, which is this idea of remote care. And we were particularly interested in the online variants of that grew in popularity during COVID, but in many cases are still being used. And the comparison would be traditional midwife visits or traditional modes of maternity care. And then the evaluation would be, well, are there any barriers to this? Are there any facilitators, obstacles? Are there any risks involved? And this was a topic where we did have stakeholder input, which is often useful in qualitative types of review. And it meant that we could learn about the different tools being used for online video conferencing, remote care of other types, telecare, as it's sometimes called, telemedicine. But we could also think about the specific issues that might arise, the things that might motivate women to want to use remote care or might put them off using remote care. So it might be that if they have busy lives or they have difficulty traveling for whatever reason, then attending an appointment could be hard, but doing something online could be more convenient for them. On the other hand, they might lose privacy if they're in a home where there's somebody else in the room with them at the time where they're having a conversation with the health professional. So some interesting themes arose from that, from the stakeholders, which we could then run targeted searches for over and above what was laid out in our initial SPICE framework in relation to the topic. So this is one example of where a question framework prompts you to think, and then conversations with your colleagues or anybody else that you can get to input can encourage you to sample data from elsewhere. And often that's not going to be addressed in a single big bang search. That's going to be addressed through these kind of iterative searches prompted by external factors. Just keeping track of that process is what's important to show that you've not lost track of what you were initially interested in. If I tried to search for that topic in the big bang way, it might look something like this. So I've got the first few lines here, lines 1 to 5, all looking at this idea of remote care. Again, not a perfect search string, but it's an example of how you might tackle that. I've then combined that with lines 7, 8, and 9, which are all about the fact that it's specifically maternal care that we're interested in rather than other types of medicine or remote consultation. And then I've used a qualitative filter in line 11. And this is from the same organization that gave us the randomized control trial filter that I used in the previous Big Bang search, the PICO search, but with the caveat that qualitative filters are generally not as reliable as randomized control trials. There's not the same body of strong evidence telling you which ones are reliable and which ones are not. So caution where using those. When I talk about search filters, if you're not familiar with that term, these are expert searches. You add them to the end of your topic to find a particular study type. And the best place to look for them is the ISSG search filter resource, where many are collected for different purposes, be that study types or in some cases things like geographical filters. But as I've said, the qualitative ones are not as great generally as the quantitative counterparts. Why is that? Why are qualitative studies more difficult to find? Well, some examples of why titles and abstracts don't always use the same kind of language to describe qualitative studies. They may not talk about the methodology they've used, like I don't know, phenomenology or whatever. They may talk about experiences, views, expectations, but equally, those kind of words may be used in the context of other types of study that you're not interested in. They may refer to specific methods of data collection, or they may not. And again, the same with the analysis techniques. Excuse me. And that quotation, incidentally, is taken from the chapter I worked on with Claire Stansfield from the new Cochrane-Campbell handbook. Bob mentioned it earlier. You can already access that chapter online if you're a Cochrane member. It'll be published in full, I think, later this year. So bearing in mind these problems with qualitative filters, it's often a good idea to design your own for the types of qualitative evidence in which you're interested. And Andrew devised this mnemonic. He likes his mnemonics and acronyms to think about the different ways in which you could search for qualitative evidence. So you could just use generic terms like qualitative, but you could also refer to specific methods, to specific software that might indicate qualitative approach, citations to key qualitative method studies like Glaser and Strauss, phenomena, data, etc. I should say, if you use all of these, you will end up with an extremely sensitive search, almost to the point where it's hardly worth buying a filter at all. So these are prompts to make you consider, would it be useful to use one of these? And if so, use one or more of them, but I wouldn't expect you to use them all. So what's going to work for your topic? Are you going to go for that big bang search, or are you going to go for something more iterative that allows you to devise your priorities over time? I think the big bang search gives you that feeling of confidence that the project's within scope. It's gonna run to a set time period. You know how much evidence there is. That allows you to cost it properly, and you know what competitors are potentially out there, and you're not going to drift off topic. But the problem is that things can emerge during the review which are interesting, and if you haven't given yourself time to investigate them, then there might be something lacking in your final review product. And I've talked mainly about the search itself rather than where you might be searching, but it's worth noting that with qualitative reviews, you probably want to go beyond the traditional bibliographic databases. You probably want to think about some of these other methods of finding information, whether that's expert input, people suggesting papers, supplementary methods such as citation searching, or web and grey literature searching. So why is that? Well, qualitative data, what's interesting about it is its richness, which means it might be in longer form documents than the traditional peer-reviewed journal article. So you might want to look for monographs, reports. You'll probably be looking at topics. Is that fair to say? Probably. Let's just say often be looking at topics where the literature is distributed across a wider range of disciplines. And so you might find it useful to look at social science sources, and perhaps at those big multidisciplinary databases like Scopus and Web of Science. I find those very useful for breadth of coverage. I do also find them quite noisy. The same is true of the mega indexes, these new sources like OpenAlex and lens.org, which are freely available and full of scholarly content, but they have pretty much no indexing and very limited search interfaces. So it's breadth, but it's not precision. High sensitivity, but low specificity. And you might want to look for things like theses and dissertations, library catalogues, which wouldn't normally be part of your traditional Cochrane type search. You may be more interested than usual in grey literature. And I often find it regrettable that this is like an afterthought for many people in their reviews. It's something that's appended onto the end of, oh, we've got to check grey literature as well. Mark, could you do that? And I always say, well, what do you mean by grey literature? There are so many different types of literature that might fall under that. So it could be some of the things I've already mentioned, like theses and dissertations. It could be conference abstracts. But really, is a conference abstract on its own useful? It's probably not got the richness of data that you need, but it might put you in touch with an expert working in the field who might be prepared to share richer data with you. It might be that you want things like reports from governmental or non-governmental organizations, maybe from charities or patient groups experiencing a particular disease. Unfortunately, there's no killer source that contains all of this stuff in one place. Um, I will say there is one very good resource I've started using in the last year or two called Overton. And no, I'm not on commission, sadly, but I have found that quite impressive for grey literature searching. You can have sort of preferred sources that you want to search. And it's also useful from an impact point of view if you're trying to see where your own research has been cited. So I found it quite interesting that some papers I'd worked on had ended up being cited by government policy in different countries. So that was a way we could demonstrate our impact. But even so, not Overton or any other source is going to be complete in covering the grey literature. So you will need to be strategic. You will need to keep records on the process. And I would refer you, again, it's Stansfield, Claire Stansfield at UCL, a brilliant author who has written on exploring issues around website searching and grey literature. And she has some templates for recording grey literature searches, including the sites you visited, the terms you've entered, and the numbers of results that you found. That makes grey literature searching much more transparent, and I refer all of my students to that. You might also want to consider citation searching, either in the latter stages of your review to make sure you've not missed anything, or sometimes as an early stage for the purpose of scoping. And I think the danger with citation searching is people often only think about the reference lists and about working backwards, but you can move forwards from references as well, ensuring that you're not just traveling further and further back in time. The diagram here is from a recent paper by Hurt et al. On the TARSIS or TARKIS statement, which is about the appropriate reporting of citation searching. Apparently, the TARKIS is nothing to do with Doctor Who. I was very disappointed to find that out. If you're trying to find some papers from which to develop a citation search, you might do that through the berry picking approach, where you're exploring a topic cautiously, using a bit of serendipity to stumble across interesting references, but not expecting to be comprehensive. The danger with that is this idea of mission creep and losing track of focus. It might be alternative that you have some pearls that have been supplied to you by a colleague, by an expert that's working with you, and that you can do some sort of pattern recognition. So you can look at the terms that are occurring in titles and abstracts, and then also the way that they're indexed in particular databases, and develop a search strategy based on them. Andrew's an advocate of what he calls cluster searching. This involves not just looking at citations, but also sibling papers, papers that have a relationship with your original study, and perhaps are by the same author or different outputs from a study, in order to find, for example, a paper about a trial that was looking at a particular condition, maybe looking at those authors or some of the authors that they worked with, you might find that they also did a qualitative study about the same patient group, the trial subjects, but what you want is the qualitative data about their experiences of living with the illness. His paper on cluster searching explains all that far better than I can. You're probably thinking there's a lot of different approaches here. How do I choose which one's right for me? I would say don't just choose one approach. Expect to use more than one approach. It may be that you use them sequentially, or it may be that you use several at the same time, and then you put the results into tiers. This avoids your team having to look at the same records more than once. You can run several sets of searches, and then if you're importing them to say EndNote, as that's the software we most frequently use, although some people have started to use Covidence, then you can look, for example, at a highly targeted set of results that you know are going to be relevant because they're in precisely the right context. And then you can look at a second set of results, which is broader in context, but perhaps has other restrictions placed on it. I've got the example here of looking at minimum unit pricing in Scotland, or looking at other methods of alcohol harm reduction, so expanding the intervention concept, but limiting the study type there to reviews. So you're sampling globally about a bigger topic, but you're being more demanding about the types of study that would be eligible for inclusion. There's no right answer to what's going to work. Every review question requires a different search approach. Just got a couple of case studies here, one from Fleming saying that a simple search strategy was as effective as a complex one. That may be the case for you. It may be if time constraints are an issue that you can restrict your searches to a particular database. I wouldn't want to advise that for all topics. Other evidence suggests that traditional searches are only going to find a finite percentage of your results, and therefore some citation searching is a good use of your time. I'd say there's lots of evidence about the effectiveness of different search approaches, but there's not enough yet about qualitative systematic searches. So we hope that there'll be more of that soon, and you can base your conclusions on that. But the Cochrane-Campbell chapter does give you some of the best available studies on that issue. Getting towards the end now, I just want to go through what's called the 7S framework. This is something that was developed for Jane Noyes Cochrane chapter. So this was about the 7 aspects of a search that need to be considered in the context of qualitative evidence syntheses. So sampling. So if you're not sampling comprehensively, as in if you're not expected to retrieve every study, and you're being purposive or deliberate about which places you're going to search and which types of evidence you're going to include, you've got to justify that. You've got to match it to your synthesis method and describe it fully. So explanation will be required. For sources, I mean, we often go way beyond what are traditional health topics, but yes, at the very least, Medline and Synol. I have to say, I work on so many things now in public health where I spend a lot of time in the social science literature. You've got to have a structured question. It doesn't need to be SPICE, but whatever question framework you're using, you need to be clear on what the facets of that question are and where the boundaries around it are. You need to think about your search procedures. And I think there's some debate here about specificity and sensitivity. A high specificity search certainly won't find everything, but if you're going to have several iterations, then it may be necessary for each iteration to be specific. If you're going for the big bang approach, then probably you're going to prioritize sensitivity. If you're applying filters, they should obviously match your purpose and be conscious of the limits of the available filters, so be prepared to augment them using that escapade mnemonic selectively to think about the other facets that might indicate something's qualitative. If you're going to use supplementary strategies like reference checking, well, that's pretty much expected, but you might do some forward citation searching, or you might use the cluster method to look at sibling studies with the same authors or from the same population. And lastly, I haven't really touched on this yet, but think about standards for reporting. So Prisma S is the default standard for reporting literature searches for systematic reviews. There are some ones more specific to qualitative synthesis like NTREC and Emerge, and you do investigate those to make sure that you're complying with them. And look for examples of good reporting of qualitative approaches, especially in relation to some of these ideas of iteration and searches which have more than one phase and have to provide a narrative justification of that. So some of you will be listening to all of this and thinking, well, this all sounds like a nightmare. Is there any way we can just get the software to do it for us? This is the conversation I have over and over again at work nowadays. I mean, AI is going to change the way we do evidence synthesis. That's indisputable. It already is. However, it's not as simple as just feeding your question in and getting a response. And thank goodness, really, because we all want to keep working in this field. I think actually the kind of questions that we explore through qualitative synthesis are going to be the last to be automated, because we're typically dealing with fuzzy concepts, things that require different perspectives to be considered. Contradictory perspectives need to be resolved. And algorithms don't like that. If they like to select more of the same, they don't like to sample for diversity. That's called hasty generalization, I'm told. On the other hand, the fact that there's more of literature available in full text online, and that there are tools like SCite, which allow for the searching of full text literature, might be useful for finding that richer kind of data that we want to use. As I said here, my prediction is that AI will get rid of some of those easy tasks that we do late on a Friday afternoon when we're tired, or on a Monday morning when we're still in weekend mode. It'll take away the easy tasks, but it won't take away the difficult tasks, the ones where we need to step away from the detail and think in more abstract terms and make connections. We need to keep that helicopter vision over a topic and to be able to give the instructions to the various tools as to what we require. Just a few tools I will mention there worth exploring. Elicit, great for answering seed articles and analysing them. Copilot, for if you're struggling to understand an article, giving you explanations of it. Or Consensus, which will attempt to answer questions, including some pretty challenging questions of the type that I might tackle. It will try to give you an answer that's based in the literature evidence to do that. But always use these things with caution and watch out for hallucinated references and such like. I think I've already mentioned reporting standards, so I'll skip over that. So last but not least, when to stop? The question I often get asked by people working on any type of reviews, have I done enough searching? How do I know I've not missed anything? Well, there's this concept of bibliographic sufficiency. This idea that if you're conducting a primary qualitative study, you'd want to know whether you'd captured all the relevant perspectives. And it'd be when you kept on introducing new subjects to your study and they were saying things that you'd already heard. After a certain level of time, you'd think, we're not getting anything else from this, it's diminishing returns, so let's stop. And the same is true with the interpretive type of reviews anyway. If you're not getting any more new insights or perspectives, it's probably time to stop. If your review type is more aggregative, then if you're counting studies, counting evidence, it's a little bit more important to make sure that you do find everything. And I'd just say, if you are an information specialist or librarian, then you probably will have been following what I've been saying and you'll be confident about that. And if you're not, then talk to one, because there's nothing better you can do than to work with an information specialist. Okay, I'm up to my time now, almost. So I'm just going to give you a couple of final tips. So when searching for qualitative evidence, don't just think about the types of study you want, but also the specific phenomena you're interested in, the perspectives, the experiences. Keep reflecting on your search, keep revisiting it and revising it with your questions in mind. And if you're not retrieving particular things that you expected to find, then use targeted searches to fill the gaps. Talk to stakeholders, get different viewpoints. That's what it's all about. Get some seed papers, use those as a basis for working outwards in some supplementary searches, and keep lots of notes, because writing this stuff up is not going to be easy. Okay, I'm going to stop now because I'm pretty much at time. I will leave you some further reading, and I'll invite your questions. So I'm just going to come out of my slides now, if that's okay. Thank you so much for your attention.
Thanks a lot, Mark. Fascinating and very, very thorough as expected. And there was a couple of questions in the chat. So Rebecca asked quite early on, are there any guidelines or published guidelines in reporting for the more iterative search approaches?
That's a great question. I would look very closely at Emerge and at NTREC, but I would also say that it's a fast-moving field, and depending on what you've done, it may be that you need something more recent than those. So I think that you're going to find the Cochrane chapter very useful if you haven't looked at it yet. The one by Stansfield et al. If you can't get that, incidentally, if you're not a Cochrane member but you're keen to access it, let me know. I may be able to find a way around that for you. That's probably the most up-to-date one in terms of some of the emerging techniques, especially where people have been using things like machine learning tools to assist them in the process. But yeah, I think my best advice, really, rather than looking for guidance on it, would just be to look at examples and then decide for yourself which ones are good and which ones are bad. Which ones leave you with a clear idea of what was done and any related limitations, and which ones leave you asking questions.
Great, thanks, Mark. And Jill's got a hand up.
Hi, Jill.
Sorry, it was a mistake. I meant to click the react button.
Okay.
Thank you.
Okay. Sandra, I think, has a question. She's just asking for some examples of the easy tasks for a Friday afternoon.
You'd like some, would you? I'm thinking about just when you're working on reviews, the things like deduplication, or it's the kind of the trotting out the same search across multiple platforms. The search translation, and I think when you're screening a topic that's quite a straightforward topic to eliminate what's wrong, what's a different meaning of your terms, perhaps it's eliminating the easy stuff rather than the more thorny topics where you have to get to grips with, well, is this a new perspective, or are they just saying something that I've already encountered in different words? That's the kind of the messy stuff around qualitative synthesis, which I don't think AI is going to easily take over.
Thanks, and I've been a terrible host because I've ignored the Q&A channel. So,
right.
A question from Catherine. Have you ever used co-citation searching in a review? And if so, was it useful?
I have not personally, I'm afraid. By co-citation searching, you mean in the Tarsis sense of papers that cite the same papers that cite the same papers as the ones that you're looking at, I assume.
Yes, that's right. I've routinely do forward and backward citations, but I've never in a review. I'm aware of the techniques to do co-citation searching, but I'm just wondering if in real life you've ever done it and if it was useful.
I can't remember ever doing it, although I am thinking, now you put me on the spot, I am thinking about the Armada project, which is the remote care in maternity care. I'm thinking about that one because we were struggling with that one to come up with all the names of the software and the array of terminology around telemedicine. We might have done some of it there, and because it was a small field.
Yeah,
and I think we did do it there, but I would only do it with a very emerging concept like that, where the literature is really scarce. That's the only place I can personally see value. Others might disagree.
Oh, thank you. Thanks.
And Andrea's asked, would you use something like lip maps for cluster searching?
Oh, I think this might be where I learned something. Lip maps. I'm not familiar with lip maps, I'm afraid. If anyone wants to tell me more about that, I'd love to know more about it.
Andrea, are you still on the call?
Yes, can you hear me okay? I haven't got my headphones on.
Yeah.
It's a bit like connected papers. So it does that. It looks at common citations and common references, common citations. So it seemed to be matching what you were describing as cluster analysis.
Okay.
I hope I haven't got the wrong end of the stick there, but it's something that you plug in a paper and it does that for you. And it's not to use instead of the database searching, but it could supplement it in that same way that you were describing, perhaps. But there's connected papers as well.
Thank you, Andrew. I'm going to write that down. Lip maps. Because I've always used Web of Science for many years to do my citation searching, and then recently I've started using Citation Chaser, which I really like. I find it quick and efficient as a way of gathering stuff. But I'm always interested in new things. And actually, having just come back from eHill, the guy from Tarsis was there, and he has challenged me to rethink the way I do citation searching quite a bit. So I'll take that on board. Thank you.
Yeah, you mentioned lots of things that I need to look at as well. Thank you.
It's hard keeping up.
Yeah.
Cheers. And then there's one from, I'm not sure if it's Yasmin or Michael, because there's no comment, and apologies, Yasmin or Michael. But their question is, just give me a second. One thing that regularly struggle with when having two potential populations, how do I shape the search so that the outcomes, perceptions, experiences, etc., are to a specific population, i.e. patient, but not health professional, or vice versa?
Okay.
Yasmin,
so if you've
thanks,
got
Yasmin.
if you've got two potential populations, just to be clear, Yasmin, are you interested in both populations, or are you only interested in one?
When I'm only interested in one, for both it's fine, but I support a lot of students, and this is the number one thing that they struggle with, is say they're interested in particular health professional, experiences, but of course there's a lot more literature on patients, and so that's
Yes.
what seems to come up. And I was wondering if you knew a way other than manual sifting to allow that to come up a little bit more in a sec.
Thank you, Yasmin. Thanks for clarifying. So I do know a way, but it's not completely foolproof. And it might be adequate for your students, but it might be questioned if you were to do it in the context of a published simply because of what could go wrong with it. So it's a high precision strategy rather than a high sensitivity strategy. So it would be about looking for the terms for health professional adjacent to, or otherwise, it'd be adjacent to is Ovid syntax. It may be near to or within, depending on which platform you're using, then your terms for perspectives or opinions or whatever. So it would be a really long string along the lines of, I'll just type in the chat, nurses or doctors or midwives. This is Ovid syntax adjacent to. I'd probably go further than that with my synonyms in each set of brackets, but it would be a nest of brackets about the professionals and a nest of brackets about the views and perspectives. Yeah, as I say, not foolproof because you could miss an important term there. But the other thing you could do, of course, is if you know any relevant papers at all that would meet your inclusion criteria, then you could look at the way they're indexed in a database like Ovid, or like Medline or Synol or whatever else, and then use similar syntax to try and find more of the same.
Great, thanks, Mark. And then there's one more here in the Q&A before I nip back into the chat from Katie McAllister. And is AI less good at screening qualitative studies versus quantitative, given that inclusion criteria tend to be more subjective?
I would agree with that. Yes, I don't claim to be an expert on AI. I felt like I had to talk about it a little today because people would expect it. We're all talking about it. I have spoken to James Thomas from the Epicenter about this, who is an expert on AI and really properly understands it. And he wrote the section on AI for the Cochrane chapter. And he is quite pessimistic. In fact, generally, he's not that kind of guy at all. If you know James, he's really jovial and enthusiastic about everything. But when it came to talking about its role for qualitative synthesis and qualitative screening and searching, he was like quite bleak, surprisingly so, because of all the issues you've identified to do with the complexity and this fuzziness thing and the idea that it can find more of the same, but it can't cope with complexity and difference. So I think we've got more time in this field than probably in the more traditional number crunching types of review. So I'd embrace qualitative synthesis while we still have a job.
Thanks, Mark. And then finally, just because we're just nearly out of time, Catherine Devine has just posted that she just wanted to give a plug to the SR Community of Practice Discord, where people can share links to some of the cool software and things that have been mentioned. But as I say, all of the recording links, the slides, and the interesting links people have shared in the chat will be circulated to everyone. So we're just about out of time. So I just want to say thanks again, Mark, for a fascinating talk. And thanks, everyone, for engaging, as usual. Been a really productive hour. And
thank you, Bob.
Hope you all enjoy the rest of your days.
Thanks, everyone. Great conversation. Enjoy
Cheers.
your afternoon.